Okay, so welcome back to the Introduction to Prescriptions. This is your part 2 screencast. So at the end of the first part of the screencast, I'd set you a little task to practice your prescribing skills. So hopefully you have had a chance to do that. So just to remind yourself, it was this task here. So when you were doing it, you should have hopefully thought about the legal requirements listed here. So all the ones in red. If you have missed any of these, that means your prescription that you've wrote isn't legally valid. So it's important that you check through what you have prescribed and make sure that you have all these items here in red on this list and you've covered them. So each one of you will have your own way of screening a prescription, but it's important that you have your way of doing it, and so you don't miss anything. So depending on which way you want to go around, so let's say you start here at the age, moving across to the patient name and address, moving down into the date area, then the signature, and then looking at this box here. So that way you'll have your own little checklist and hopefully you won't miss anything. So remember, in the first part of the screencast we spoke about the information about the drug isn't legally required, but you still need them on the prescription for it to be clinically valid. So a reminder here about the information in the grey, so your drug name, form, strength, quantity. They're not needed for your prescription to be legally valid, but it is required for it to be clinically valid. Okay, so hopefully you would have done your first prescription ever, so keep a copy of this, frame it, put it in your room, and that's what you're aiming for in 5 years' time, to be a prescriber. So you'll have come up with something like this. So you'll have your patient name, you've got their address. If you come down, you're looking at the doctor's signature there, date, so make sure it's the date that you put on there was within 6 months, and then you've got your prescriber's address there at the bottom. And then for each of the 2 tasks you would have had your drug information, so your quantity, your dose, the form is tablets, the strength is 20 milligrams, and the name is atorvastatin or amlodipine. So we assume that this was for an adult due to the medication they're given. So they're normally adult sort of medication given to adults. So you wouldn't have needed the age or the date of birth for this patient. If you had it, that was fine as well, but you wouldn't have needed it. So hopefully that makes sense. Drop me a comment under the video to let me know how you got on, and let's see how many people got their first prescriptions written out correctly. Put up some pictures of your framed prescriptions. Okay, so let's start looking at how we are going to be screening or validating prescriptions going forward. So you're going to be doing this for the next 3.5 years whilst you're at university. So advice is that you understand it now, and then later on it becomes easier and easier the more practice you have. So when we're screening a prescription, it's important that we think about the prescription in a holistic way. So remember, you should always have the patient at the center of whatever you're doing. So you would have learnt that in your PM1C classes. So patient-centered care, shared decision making, all of those buzzwords that we spoke about in that session, for those of you that turned up. So if the patient, so you have the patient at the center of your decision, and then you have four main things you need to be thinking about. So when you start thinking about the drug, you want to think about the disease. What is it going to be doing? What's it treating? So what disease or what condition does the patient have, and what are you hoping to treat? You might want to start thinking about the drug action as well. So will the drug actually work to treat this condition? And are there any side effects you need to look out for, or advise the patient about any particular side effects? What effect could it have on any other disease, other presenting complaints, other conditions that the patient has? And then you need to think about the dose. So is it the right dose for the right patient? And then the dose can change as well depending on the condition. So for example, blood pressure, if it's mildly high blood pressure, you're going to have a lower dose. If the blood pressure is very high, you're going to have a higher dose. Or does the dose need reducing because, for example, they are elderly, or if their kidneys aren't working properly, you'll need to reduce their dose. So a lot to think about here. And then finally you want to start thinking about the dosage form as well. So is it a tablet, capsule, liquid, and how will the patient be able to manage? So for a child, you're probably looking to give a liquid, so it's easier for them to swallow. But even in elderly, can they swallow, or do they have a pipe to put their food down? So you need to be comfortable with what you're giving. Can the tablets be crushed? Can the capsules be opened and sprinkled onto food? So you're looking at dosage form as well. So a slide that you'll be keeping with you in your clinical journey as a pharmacist. So think about the pharmacology, the pharmacy, the counselling, the patient behind the prescription. So a lot to think about here. So when we're screening prescriptions, you've got a number of sources to help give you that background information to help you make that decision. So first you'll have that prescription in itself in front of you. So if you start looking at the drugs that have been prescribed, you can start thinking of trying to work out what's wrong with the patient. But then you've got information on the back of the prescription as well, which includes exemptions. So if they're over 60, it'll be listed as an exemption because they get medication for free. Or if someone's pregnant, you can get that information from the back of the prescription as well. So you might need to make a decision on what they can take in pregnancy. But then if in community pharmacies, quite often you'll have the patient in front of you, so use them. Remember, they are the most knowledgeable about their condition. So ask them if you have any concerns about the drugs being prescribed, or for example if they have any allergies. Or you might get the patient's representative, so carer, parents, so you can ask them as well. But if you have a more complex sort of clinical problem, then you may need to speak to the GP, so to the doctor or any other healthcare professional. So in community pharmacies, we all work with the patient medication record system. So in here at Reading, you'll be using Pharmacy Manager. So some of you who are already working in pharmacies may have a head start with this. So for example, your Sainsbury Lloyds, I think Tesco's as well, use Pharmacy Manager, so you'll know how to use the system. So on this record it shows you what the patient has been picking up from you before, what other drugs they take, how frequently they pick up. So are they following the treatment plan? Are they adherent to their medication, or are they missing them? And you'll be able to spot any changes that have been made to the medication. So for example, a dose change. And it's a good place to look up any drug interactions. So if it's a new medication that's been prescribed, checking if there's any interactions with their old medication that they've been routinely picking up from you guys. So you may also want to access their summary care record. So this is really useful. So it's come through in the last 3-4 years, and we now use it sort of on a daily basis. It's a summary of a patient's record which is held at the GP surgery, but pharmacists can now access this online with patient's permission, and you'll have access to the patient's medical record. And finally, if the patient has a patient treatment card, so for example if they're on a high-risk drug, let's say like high-dose steroids or warfarin, patients tend to carry a card with them, and on this you'll have the dose that they're on, if there's been any monitoring that they've needed or had done. So this really helps us clinically screen a prescription. So if you're not quite sure, look up treatment cards. So for warfarins, steroids, high dose inhalers, methotrexate. So really good for you guys to start looking up information that you're not quite sure of, and to make sure you do the background reading as well. So the things we might need to think about is obviously about the patient themselves. So their characteristics. So is it a child? Are they elderly? Or what about their weight? So you'll start learning about some medication is weight dependent. So the dose changes according to the weight. Or if they're a male or female, so could it have a negative effect on any of the hormones? Or if they're, for example, pregnant or breastfeeding, to make sure the medication doesn't cause any harm to an unborn baby. And then you want to start thinking about other disease states. So what is the patient suffering from? What else? Do they have heart disease, asthma, any kidney or liver failure? So depending on their presenting sort of underlying conditions, it might mean that we can't use a drug at all, or we just need to be careful, and we might need to do extra monitoring. And then here you've got your intolerances or preferences the patient has. So quite a lot of elderly patients have very particular drugs that they want, very particular brands. So it could be due to allergies, and the allergies could be food or medicine related. So for example, some people are allergic to peanuts, and there is peanut oil in some medication. So need to be vigilant, otherwise they could have an anaphylactic reaction. Some patients will have a dietary intolerance. So for example, like lactose intolerance. Or others might have a personal or religious belief which can affect the formulation. So for example, if a patient is vegan, they won't want capsules which contain gelatin. Or you have some patients of particular faiths who don't eat pork, and there are some insulins out there which are derived from pork, so they won't want that. Or maybe depending on the time of the year, patients might be fasting, so again this will impact on how they can take their medication. So this is all about the patient here. So who is the patient? What is the patient about? So the medicine might be right for one patient but not for the other. So things to be watching out for. So what are you looking for when you screen a prescription, when you're looking out for whether it's clinically valid? So the kind of things we like putting into the tasks when you're going to be dispensing, when you're going to go into your dispensing classes. So you need to think about the patient factors. So here you've got contraindications and cautions. So what do we mean by that? So a contraindication is a disease state where you must not use a particular drug. So you shouldn't use a particular drug in that condition then. So for example, like using a beta blocker in asthma, you shouldn't use them because they can narrow the airways, and then that in turn can cause an asthma attack. So you would say a beta blocker is contraindicated in asthma. And then a caution is something where you have to be careful. So most patients can still probably use the drug, but it may potentially cause a problem, so you have to be extra careful. So whether that's extra monitoring, making sure they're not getting any side effects, so you need to be monitoring that. So I've already mentioned allergies and intolerances before. And then what about if the patient can't swallow their medication? So do they have any difficulty in taking their medication? And the last one on here says administration aids. So by that I mean helping the patient taking their medication. So elderly or arthritis, if they don't have good dexterity in their hands, they might struggle to squeeze a eye drop bottle. So there is an aid out there to help them squeeze that bottle. Or some might struggle using their inhaler. So making sure they take an appropriate inhaler to help them, making sure that they can take their medication and they get the most out of that medication. You might have people with poor eyesight, so you need to use large fonts on, for example, labels. And then if we look at prescription, so we mentioned quite a lot of this in the first screencast. So looking at the date, so is it within the 6 months? Ensuring the prescription is clear, so you can't assume, you can't guess here, because remember, sometimes this could be life and death. If you give the wrong medication, you could kill a patient. So really need to make sure that the prescription is clear and you understand what it says. So if there are any abbreviations like U for units, it can be easily mistaken for a 0, or microgram, so mcg, can be mistaken for milligram sometimes. So look at the quantity that's being prescribed. So this is especially important if it's like an antibiotic treatment, because remember, it'll be a set sort of duration, set course. So for example, for 7 days, patients must take it, but if the right quantity hasn't been given, then the patient won't have enough quantity to complete the course, and then the infection might come back. So really important for patients to complete the course when they're given antibiotics. So you need to think about what drug is being prescribed. So is it correct for that particular condition? And then making sure you're careful with any similar looking names or drugs that sound the same, or any similar packaging. And then interactions between drug versus drug, and then drug interacting with any particular food. So if we look at the regimen, so is the dose correct? Is there an overdose or an underdose? And this could depend on age or patient's weight. And then finally think about any extra counselling points you need to let the patient know when handing out the medication. So counselling we'll do next term as well, where you'll get practice handing out medication and counselling patients. So let's go through a couple of prescriptions. So let's put your knowledge to test to see how you've understood the screencasts. So have a go at trying to check if this prescription is legally valid. So I'll pause for you guys to have a look at this. Okay. So how did you guys get on? So again, leave some comments in the under the video. Let's see what you guys came up with. Who spotted if there was an error, or who would have let that go to the patient? Okay, so hopefully you will have seen the prescription hasn't been signed. So remember, you're starting from the top. So again, we're thinking that this is an adult because of the medication that he's on, and tablets, 50 milligrams. So there's no need for an age, date of birth. You've got the patient's name and address and postcode. You work your way down, you come to the date. So it's out of date because it's not within 6 months, it's over 6 months old. You work your way across, there's no signature here. You come to this box and you've got the name and the surgery practice address. So 2 errors on this prescription, so that no signature and no date. But you see what I mean earlier on by having your own way of screening. So if you start from the top, go clockwise, the round, and then here, and then after you look at your medication. Okay, so let's give it another go. So for those that didn't get that first one, let's see if there's better luck this time. So remember, starting from the top, going all the way around, and then to your medication. So I'll pause it again. Okay, so was that one a bit more trickier than the first one? So let's have a look. So leave me some comments. I'll want to see how you guys have done before our next workshop, so I know where you guys are at and how well you've understood the screencast. So for this prescription, you've got your, again, adult, you've got your patient's name and address, work your way around, it's within the date, so it was prescribed last month, so that's fine. You got your patient signature, you got your doctor's prescriber's name and address. So then let's move to the clinical area, so to the medication, so details of the drug. So you got 2,000 milligrams, so 2 grams of paracetamol 4 times a day. So for those eagle-eyed or whose parents take paracetamol or who check the dose in your BNFs, you would have seen that this dose is too high. So it's an overdose, so it's a clinical problem. So legally it's valid, but clinically it's inappropriate because the dose is too high. The recommended dose for paracetamol is 1 gram 4 times a day. So the first task had a legal problem and this one's got a clinical problem. So in your dispensing classes, you're going to come across both types of problems. So you need to be able to do both of them properly. It's no good being able to legally screen but not clinically. They go hand in hand, and you need to ensure it's safe for the patient to take legally and clinically. Okay, so I hope you enjoyed doing those 2 tasks and looking at how to do it, because you're going to be doing lots of that next term and throughout the years. So if we find a problem like that, what do we do? So it doesn't matter whether it's a legal problem, like with the date, or if it's a clinical problem with the dose. So you'll have a way to sort of solve these problems. So for example, do you need to speak to the prescriber? Or can you get away with sort of speaking to the patient? So sometimes if you only need some small information, so for example like a weight of a child, you could speak to the parent rather than trying to phone the prescriber. But if there is an issue and you are concerned, you don't want to sort of at the same time worry the patient either. But then at the same time, you don't want to be criticizing the prescriber either. So remember your GPHC standards that we all have to adhere to. It states that we need to work together with different healthcare professionals and we can't be going out there saying that your doctor's really rubbish and they've made a terrible error. And then think about how urgent is the problem. So how urgently does the patient need this medicine? So do they need it today? Can they wait a couple of days? Do they already have some medication at home? So think about it, how quickly do you need to do this? So could the error be dangerous to the patient or not? By dangerous, we could potentially harm the patient, we could hospitalize the patient, if it's an overdose, the patient could die. So lots of things to consider. So you need to look at all the different options available. So what options do you have available to you? So are you going to speak to the prescriber? Are you going to ask them to change something? And if you are, anyone who's ever dealt with a prescriber, a doctor, or a consultant, you'll know that they don't have any time. So you need to be prepared to recommend an alternative product. So for example, with the paracetamol, it was an overdose, so you need to come up with an alternative dose, which would be, can you change the prescription to 1 gram 4 times a day instead of 2 grams 4 times a day? You need to come up with the alternative drug, dose, recommendation, all those things. And then think about what follow-up is needed. So are you going to send your patient away and then ring them later on once you've solved the problem? Do you need to speak to the prescriber again? It's not always straightforward that you can deal with it straight away on the phone. And then following up with the patient to see if everything's all right or if there's any concerns or questions. Okay, so that's the end of this second screencast. So part of the Introduction to Prescriptions lecture. So hopefully you've had a chance to watch and re-watch the first and the second screencast together. This will form our bread and butter of assessing prescriptions, being able to label, being able to screen. So we've covered quite a lot in the last sort of hour and a half. So the types of prescriptions that you might encounter, we've looked at those. Looking at sort of the legal requirements for a prescription. Looking at how to check for basic sort of clinical safety, clinical errors. And then if you do have those prescribing errors, whether it's legal or clinical, then how do you solve those? So in your workshops later on this term, you're going to get a chance to practice what we've just done today. So you're going to get a chance to practice screening prescriptions. And then next term you'll have a chance to put it all together, where you're going to start looking at how to label, then dispense, and then also how to counsel patients on their medication. So at the end of spring term, so at the end of next term, you're going to have a test where you'll need to be able to screen the prescription as part of a dispensing process. So it's very important that you understand this lecture. So it's recorded. You can post in the comments or on the Padlet. But you need to be able to understand this lecture really well. Okay, so you're going to not just be doing this for this term or for your exam or next year, you're going to be doing this for the next 40 odd years as practicing pharmacists. So it's really important. Okay, so I think that's it for now from me. So thank you very much for listening. Hope you enjoyed that. And we'll be starting our journey into prescriptions very shortly with doing some screening of prescriptions. Brilliant. See you guys soon then. Thank you.